Hello, everyone. I'm calling from my home in Illinois, and I hope you all are doing well. I wish I were there sometimes in person so I could interact with you in a personal way and get to know you better. But this is pretty amazing that we can do this halfway around the world. Um, Tonight, I want to just briefly review, since it has been a month, our mental health disorder that we have been talking about is OCD, obsessive compulsive disorder. And I want to say right here at the front that previously we have talked about obsessive compulsive personality disorder, and that is different, although it does have some of the same basic symptoms and traits with obsessive thoughts and compulsive acts and behavior to reduce anxiety. And as we have learned, sadly, many of our mental health issues today have come from environmental factors, personal and family, trauma, abuse, cumulative chronic stress. Some of these we have talked about also have some similar symptoms that go across the board, and also very similar treatments, which we have predominantly two options for treating mental health, and that is through psychotherapy, and cognitive behavioral therapy is the primary choice of therapy, and then medication. I don't know there in the Philippines if maybe down in Manila or Davao or Cebu, some of the bigger places in bigger hospitals, they may have a few of the other treatments that are advanced, that have to do with putting electrodes either by the scalp or inside the brain. These are new, and here in the States, they have been approved by our federal drug FDA, Federal Drug Agency, and so I don't know about there, but anyway, it'd be interesting if some of you could tell me, even Chaplain Nato, what kind of advanced treatments you have in some of the larger places for some of these mental illness disorders. And also, if you have inpatient treatment centers now in some of the larger places, I'd like to know that. As I have dug in and studied for each of these, I've been amazed at how many treatment centers around our country that are specialized. I found a treatment center that was specialized for young adults with obsessive compulsive disorder, and usually treatment like that in a residential treatment center, the illness, the mental illness is quite severe, and so that is what is needed. I'm just curious if you all have that there, or even if you know, because I was not aware that we had so many treatment centers. Living here in the States since COVID, the mental health crisis has soared, and all I read and hear about is that we do not have enough facilities, we do not have enough mental health physicians or nurse practitioners or people that work in the mental health field. So anyway, just food for thought. Tonight I'm gonna just kind of go over again obsessive compulsive disorder, and I was surprised that it affects 1 in 40 adults and 1 in 100 children, according to the World Health Organization. Sometimes when people think of OCD, they think of humorous characters that they've seen on TV shows or movies who always want to sit in one particular seat or who need to wash their hands repeatedly. But in reality, obsessive compulsive disorder is no laughing matter. It is serious, it can be serious, and it's usually chronic. So OCD can appear in various forms and be composed of both compulsions or acts or behavior of a certain kind and obsessions. So obsessions are thoughts, images, or impulses that repeat again and again. Usually there is a feeling of being out of control when obsessive thoughts are present. So these thoughts are just very intrusive and they just won't quit. They keep on repeating. Obsessions can leave those experiencing them with fear, frustration, disgust, restlessness. OCD obsession can also manifest itself in the form of intrusive thoughts that may or could lead to severe anxiety or panic attacks. And we talked about those kind of symptoms a lot since we've been doing the CPE units. Compulsions are used to, it's compulsive is a behavior that is almost an uncontrolled behavior, and they are used, a person will do these compulsive acts or behavior to try to fix or correct and bring some stability to the anxiety they're feeling, to correct the thoughts or the feelings brought on by a person's obsessions. So an example might be if a third party sets the table for a person suffering from OCD at a restaurant, that person may need to reorganize the table if it's already preset, and they need to reorganize the table to fix the incorrectness of the previous arrangement. So compulsions can manifest themselves in a variety of forms. So we're going to talk about 7 strategies to cope with OCD. And no 2 cases of OCD are the same. So sometimes our plan of care will maybe generally the framework might be a beginning, but it might take a different approach according to the individual. And it's also, like other mental health issues, affects the whole family system in the home and work, play, whatever. It affects the whole family. So knowing, again, what we've talked about in the past, knowing yourself, knowing triggers, having a plan in your mind are some of the best strategies for coping. And so I'm going to give you these 7. This was listed with a family psychiatry and therapist group, and they are out of New Jersey, and the author of these is Dr. Helen A. Miller, and so this is actually a clinic. Number 1, greet your OCD. People can feel ashamed, embarrassed with OCD because it's so obvious when the compulsive acts are coming to try to stabilize the intrusive thoughts. And so people know when there is a person with a pretty moderate to severe OCD around them. And so the patient who has the OCD, instead of fearing it, can befriend it, or as this doctor says, greet your OCD. And for children or teenagers, they even suggest giving it a nickname, bully, OCD bully, Bob or Buddy, and helping to bring the negative image out of the closet, out of the darkness, the shadows, into the light, making it easier to acknowledge and just name it, and that it is a mental health illness or like a disease, like any other health issue. And so if your child is suffering from OCD, this approach to discuss with the child about talking as if it is like a imaginary friend or something like that. Number 2, this is I've seen this over and over and over. Keep an OCD journal. Sometimes people keep spiritual journals, sometimes people keep food journals, and this is a way to help you keep track of a person's triggers, or maybe even discover new ones. So if you have a journal, that person can write these down and just kind of look back and see overall how they're doing. So it suggests to carry your journal everywhere with you, wherever you go, and to write in it. And then when you're done journaling for the day, read over your entries and ask yourself questions, reflection questions, like, why did these situations trigger my OCD? What would have happened if I hadn't performed my resolutions, the compulsions? So just reflection questions. And then number 3, exposure and response prevention. The acronym letters are ERP. ERP. It is a common way of facing and possibly relieving some OCD. So when using ERP, one exposes him or herself to a situation that results in an obsession and then does not engage in the fix-it compulsion. So try building an OCD ladder by listing out your fears and the triggers on a 10-rung ladder in order of severity from 1 to 10. So you would have the 10 obsessions, and then what were the triggers and how severe they were. So that is called exposure and response. And the progress that can happen with that is you slowly build the time of the exposure of the trigger and waiting and refraining from trying to do an act to relieve the obsession or the trigger. So number 3, that was number 3, sorry. Number 4 is refocus your attention. So if a person is experiencing these compulsions or obsessions and you feel one coming on, try to refocus your attention from the situation. And this was also a strategy with panic disorder, let's see, what were some of the others that we've been talking about? But anxiety, panic, is to try to get your mind off of it as quickly as possible and divert your eyes, your ears, your thoughts to something else. So that can be done physically or mentally. And at the end of the refocusing period, if you still need to complete your obsession, try repeating that again to refocus. So you can physically refocus your attention by doing some kind of movement, or like jumping jacks, or running in place, or get up from the chair and walk around. Play with some kind of fidget toy, or with an animal, a pet that's around, or hum a song. So that is distracting or redirecting your attention physically with your body. And then mentally, you can refocus your attention by listing everything you see around you. So that is taking your thoughts off of the obsession, the trigger which causes the obsession, and you are being present in the moment to the things around you, and you're thinking about, okay, name every color you see, list everything you see. Hi everybody, I apologize. I didn't pay attention to my battery and it was low and it just went out. So here I am back again. And the last thing I said was to remind yourself of the facts that it's okay that a person has this OCD personality disorder, or more of the more severe obsessive compulsive disorder, mental illness, and that we don't want to get into a cycle of doubt and blame, but we want to try to break those cycles because of the power of that thinking and emotional downhill spiral that it can cause, and to remind the patient that, or the family member, that it is a diagnosed medical condition. And so it would be like somebody that has asthma. Would you be mad at a friend who has asthma that needed to stop and get out the inhaler and use that for the asthma? No. So we need to normalize, especially that's what's happening in America, is to normalize mental health and to see it for what it is, that people aren't just crazy, they're not just all on drugs, and that there are some brain chemistry, body chemistry that is off balance. There's trauma, there's abuse, there's stress, there's a lot of things that are causing the disruption in the brain signals, and that play a part in every part of our systems. And so we can help the brain, the mind, to get different thinking patterns and strategies to manage and cope with a lot of mental illness, unless it has turned into something severe, and then it needs inpatient treatment and maybe other more sophisticated electrical stimulation to affect the brain waves. And so anyway, if you are around someone that is feeling guilty or bad about having OCD, help people to realize, and even people that are around someone with OCD, to realize that it's not a laughing matter, that it's very hard on the person who has it, and we want to normalize it for them, especially if it's one of your counselees or a patient family member in the hospital, to help them realize, you can manage, you can get help. And now we're going to talk about the different medicines which we have talked about before with some of the other mental illness. But if someone does not know, let me back up here. If someone does not know that it's not been diagnosed with obsessive compulsive disorder, OCD, one of the first things you do to get a diagnosis is a psychological evaluation. And this includes the psychiatrist, the psychologist, the certified counselor would want to know your thought patterns, your feelings, your symptoms, and the behavior patterns that get manifested with this obsessive compulsive disorder, and which ones really interfere with daily life. And so, you will be talking to your family, your friends, your coworkers, but to ask them what they noticed maybe. But doing that and having a professional psychological evaluation, a lot of people go to their primary care doctor, their general practitioner, and then they try to give a physical to see if there's any other thing going on. And then maybe, I don't know where you live, but if there are some mental health specialists or psychologists in the area, then to have an evaluation or an assessment. And then there is a diagnostic and statistical manual of mental disorders. It's called the capital D, capital S, capital M -5. And doctors use the criteria listed for obsessive compulsive disorder to help guide them to see if a patient has this criteria, meets this criteria for OCD. And then I mentioned the physical exam as well, so that to make sure the symptoms may not be coming from some other issue or disease in the body as well. So, and especially it's challenging because of anxiety disorders, depression, schizophrenia, or other health disorders. They all kind of sometimes can interplay with each other and manifest, and a doctor or mental health specialist might think, oh, it's this. So to get a very accurate diagnosis, it takes several different avenues of diagnosis or assessment. So let's see. I've already mentioned this, but treatment may not result in a cure. This may be a chronic, in some cases lifelong disorder. The earlier it is discovered in children and young adults, the better, because then treatment, whether it's cognitive therapy, cognitive behavioral therapy, or if it's moderate to severe and medication is needed, but they can learn early to know the triggers and what to do before it progresses so much. So children and teenagers, adolescents, young adults. And the two main treatments are psychotherapy and medications. I mentioned cognitive behavioral therapy because it is one type of psychotherapy, and it is effective for OCD. The other one that is the acronym ERP, exposure and response prevention. So it's a technique that is to help prevent it from getting worse. And so you expose the patient to something that causes the trigger, and then there is the building up of waiting. Hello again. I don't know what's wrong, but anyway, I was through giving the content and I wanted to say goodbye. And so thank you for being patient with me and all of this. And just as I close, may we all learn how to cope with stress, to be patient with ourselves and with our patients, with our hospital patients, with our counselees, and helping them to expose themselves to fears, a ladder of fears, 1 through 10, and list those, and then beside that, the trigger that will occur. And to keep a journal, a little small piece of notebook that you can carry around with you. And so every time a person feels a trigger, to write that down and to write what's going on. Refocus attention, and also get the professional resources that a person needs for OCD. So that's all I have, and I hope you could understand this. And like I said, message me anytime, and God bless you all in everything you're doing in your life, and be healthy and well. Amen. Goodbye.